Good day, sir. My name is Melissa Galpao from PSN 1A. Today, I will perform a return demonstration regarding assessing the hair, skin, and the nails. So before we proceed to the procedure, we need to perform the hand hygiene or hand washing. So hand washing is one of the most effective means to prevent flus and other infectious diseases. So after the hand washing, we can now proceed for the PPE or what we call personal protective equipment. So the first thing that we need to wear is the mask. So make sure from your nose under your chin. And mold the nose strip to set your feet and check for the air escapes. And that's normal. So after that, we can now wear the gloves. So, PPE is a precautionary step to protect ourselves and other people around you. So, after that, we can now proceed for the procedure. So, good morning, sir. Before anything else, I want to introduce myself first. My name is Melissa Galpao, your student nurse of the day. Are you Panfilo Pagirigan?
Yes.
So, your birth date is August 20, 2006.
Yes.
So, that is the first thing that we need to do to identify our clients to make sure that we have the product in front of us. So, after that, we need to close the door and the curtain. So, sir, how do you want me to call you?
Pink.
So, Ping, I'm here today to assess your hair, skin, and nails. Why we do this? We do this to ensure that everything is normal. And if there's abnormalities on your skin like discoloration, we need to note that. And any further complication. Do you have any questions, sir?
Nine.
So, we need to close the door and the curtains to provide the privacy of our patient and to explain the procedure to relieve and facilitate cooperation. So after that, we ask the patient to remove the clothes and wear this examination gown. So sir, can you remove your clothes and use this examination gown?
Yes.
So sir, you may now sit down, sir. So after that, we need to put a blanket in order to cover the exposed parts of the clients. And we need to remember that we only need to expose the parts that we are going to examine. So before to proceed the next procedure, we need to ask the patient. So, sir, do you currently experiencing pigmentation, dryness, or swelling?
No.
So, how about, sir, do you experiencing skin problems right now?
No.
So, any allergic on food or medication?
Nothing.
So, are you using skin product right now, sir?
No.
So, sa pamilya niyo po, sir, meron po bang may history na skin problems?
Wala po.
So after that, we can now proceed for the skin coloration. So sir, can you raise your hands like this? So what we're trying to see if any signs of polar cyanosis, jaundice, or erythema that can may indicate abnormalities. So I'm expecting that my client's skin color is light to deep brown, and that is normal. So after that, we can now proceed for the skin lesions. So sir, can you raise your hands again like this? So what we're trying to look, we're trying to look of any signs of insect bites, any signs of bruises, wounds or scratches. But I'm expecting that my client's skin there's no signs of skin collision, and that is normal. So what kind of condition? It can be primary like macule or papule, or vascular like hematoma, and the worst case is the skin cancer. So after that, we can now proceed for the palpation. So sir, can I put my hand on your face? So sir, can you remove your mask? So we need to use the back of our hands. So what we're trying to feel? We're trying to feel any signs of fever shock, infestation that can make cause health problems. So, but I'm expecting that my client's look is normal temperature, and that's good. So you can now wear your mask, sir. So after the palpation, we need to palpate the texture and assessing the moisture. So when palpating the texture and assessing the moisture, we need to remember that moisture of skin folds and moisture of axilla is normal. But any signs of excessive dryness and moisture, and that is abnormal, and we need to note that. So we need to expose the pore of the skin of our clients below the clavicle. So, okay. To pinch the clavicle, if the skin is immediately back to normal, there is no presence of skin trigger. But if the skin stay pinched, that means there is a presence of skin trigger that can may indicate dehydration. So, my client's skin is normal, there is no presence of skin trigger. So after the palpate of texture and assessing the moisture, we can now proceed for the palpate of edema. So sir, can you raise your foot? So, why we invite to raise his foot? Because that are include the feet, the legs, and the ankles, but other areas also includes the hand, the face, and the abdomen. So, when we assessing the edema, we need to apply a pressure. So, if the skin become indented, it means there is a signs of edema. But if the skin return to normal, there is no signs of edema. So my clients look like there is no signs of edema, and that is normal. So you may not put down your foot, sir. So after the skin, after the palpate of edema, we can now proceed for the nails. So sir, can you raise your hands like this? So what we're trying to look of the texture, the shape and the color. If there's a presence of clubbing or blue slime on the nails of our clients. But I'm expecting that my client's nails is normal. There is no signs of abnormalities. So, and to assess the capillaries of the nails, we need to apply a pressure on the, okay? If the skin is quickly returned, that is normal. But if it is slow to return, there's a it is a slow refill on the capillaries, and that is the sign of respiratory or cardiovascular diseases. But the client's nails is normal, so you may not put down your hands. So after that, we can now proceed for the scalp and the hair. So sir, can I put my hand on your head? So what we're trying to see, any signs of skin lesion erosion, infestation. So if there's dandruff or lice, we need to note that. But I'm expecting that my scalp and the hair of my clients is normal. So after the scalp and the hair, we can now proceed for the removing of PPE and perform the hand washing. So I will remove my gloves. So make sure that there is no film on the top of the gloves. And don't touch the other contaminated area. And throw it to the trash can. So after that, I will not remove my mask, so we can now proceed for the hand washing. So removing PPE and perform hand washing after all assessment is a properly reduces of risk of infection and transmission of microorganisms. All assessment is done, it will be documented in the patient chart.